Omicron variant continues to change the game. Throughout the pandemic, monoclonal antibody treatments worked well to help vulnerable people fight off COVID-19. But this week, the FDA announced they're not going to be limiting the use of at least 2 of those treatments. But there is still hope. Doctors tell THV11's Frederick Price options are still available.
Almost 100% of the circulating viruses here in the U.S. is suspected to be Omicron.
And because of that, Dr. Naveed Patel with the Arkansas Department of Health says antibody infusion treatments like Regeneron and Eli Lilly are being limited.
These medications are not effective based on the data.
And effective against the now dominant Omicron variant, he says. The question now, what is available for COVID-positive patients who need treatment?
So there's multiple monoclonal antibodies that have been on the market.
One of the drugs Dr. Ryan Dare with UAMS says the hospital is using for mild cases is Sotrovimod.
It works on Omicron just as well as it worked on Delta, just as well as it worked on Alpha and the other variants.
That's usually given in the hospital's COVID infusion center. They see nearly 20 outpatients a day.
When we have monoclonal available, we pretty much max that out every single day.
That's an issue Patil says the state is seeing with other drugs like Paxlovid. It's proven to treat mild cases if taken within a few days after infection. But since the supply doesn't meet the demand, Patil adds patients older than 65 and high risk will usually come first.
And most of our providers are doing due diligence and giving it to patients that are at the highest risk.
Now, one thing to keep in mind, though, both tell me some COVID treatments are limited. So the hope is that once infections begin to decline, the supply will be available to more people. In Little Rock, Frederick Price, THV 11 News.
Thank you, Frederick. More options for you. The Arkansas Blood Institute is also once again collecting convalescent plasma from their donations, and you can learn more about that program on ABI's website.